Good morning, and thank you for joining us today. Nicole is not in the office. I'm joined today by Dr. Shankar Nasaturi. He is the incoming acting medical officer of health, serving Windsor-Essex County Health Unit and the region when I formally stopped coming to the office on September 10th. So Dr. Shankar Nasaturi is on the line today. I'll have him say a few words and introduce himself before we get to the Epi Summary. Over to Dr. Shankar.
So, Dr. Ahmed, thank you. Thank you for allowing me to speak for a few minutes. My name is Shankar Nasaturi. I previously served as medical officer of health in Halden and Norfolk, and I'm pleased to work with Dr. Ahmed during this transition period, and I look forward to working with the team and serving the community of Windsor-Essex. So thank you so much.
Okay, thanks, Dr. Nasaturi, for filling in the void while the health unit will look for the full-time permanent medical officer of health. Really thankful for you to stepping in to support our community. So I'll jump into our quick case summaries, what we are seeing, and then we'll go to our epidemiological summary for the week. So today we are reporting an additional 87 cases since yesterday. 14 of these cases are community acquired, 4 are travel related, and 3 are outbreak related, while the rest are still under investigation. Our active case counts have increased again. We are now at 519 cases with 361 variant of concerns that are active. Most of these cases that we are seeing right now are Delta variants. To date, we are still have 439 people who lost their lives as a result of COVID. And our current hospitalization is 16 people who are currently hospitalized, and 5 patients are in the ICU. We have 18 active outbreaks in our community with 16 workplaces and 2 community outbreaks. Our vaccine coverage is inching closer to 80%, 79.6% to be precise, for residents that are 12 plus and that have received at least 1 dose. And our fully vaccinated population that are 12 plus is inching as well, and currently stands at 72.6%. I'll now move on to our weekly Epi Summary. So like always, we always start to see what the global picture looks like. So this is what the global picture looked like. I didn't include the actual number of cases, but as cases are increasing everywhere in the world, we are starting to see the impact of these cases on our healthcare system in pretty much every country. Canada is also starting to see the increase in the number of hospitalization. Please note that the overall hospitalization in Canada has always been relatively better compared to the other countries based on all of these measures that are put in place to protect the health and safety of our community. Overall, the rates are increasing in Canada, but we can see significant increases in other countries, mainly in United States, where we are seeing that the cases are climbing at a rapid rate. Similarly, when we translate that hospitalization data into the ICU data, we can see that similar picture, but much more remarkable difference in terms of where we were before a few weeks ago compared to where we are right now with respect to ICU bed utilization. So what is causing all these spread continues to be the Delta variant, and this is what the overall contribution of the Delta cases in different countries, and we can see Canada has already jumped up to 95% of our cases that are currently being reported are all Delta variant. In Ontario, similar picture we can see here with the cases increasing, and now the province is reporting roughly around 800 cases a day, which is an increase compared to what we have seen previously. In our region, we are also seeing the Epi curve increasing in the wrong direction, with an average daily cases of 67 cases a day that we are seeing right now. Our case rates have jumped as well, week over week case rates, and it now stands at almost 110 cases per week per 100,000 population, which is again a significant increase. And if we can see and compare our data with the third wave that that the rest of the province has gone through, our case rates are comparable to what we've seen in the third wave. So significant concern in our community. Our wastewater surveillance data is also aligning with the active cases that we are seeing in our community. So basically, it is an indicator that the cases are continuing to spread in our community, and we are finding most of these cases, and the trend based on what we are seeing, that it will continue to see the increase. Another area of concern is the percent positivity. So our percent positivity has gone up to 8.9% in our region, which is again an increase compared to last week. And if we are looking our percent positivity with the rest of the province, just based on the last 7 days, our percent positivity is the highest in the province at this time. From a distribution perspective, our cases are still distributed more than 60% in the city of Windsor, while the rest of the municipalities are pretty much similar to each other with the exception of few. From an age distribution perspective, we continue to see the cases mainly in the younger population, where we already know that the vaccination coverage rate is less than what the other age groups are. From a variance of concern perspective, similar to what I've shown for based on the Canadian data, our local data also is showing all the green lines that you're seeing is showing the Delta variant, and the most commonly reported variant that we are seeing in our region now, it's just Delta. We rarely see Alpha variant or any other type of variant in our community anymore. Hospitalization data locally is on the rise again in the blue line, as we can see, similar to what the province is seeing, similar to what the ICU beds utilization looks like in our region, also on the rise with some minor fluctuation, but still aligning with the provincial data. From our case doubling time, as we know, we have always said that when the doubling time is decrease, that means we are doing worse, and when the doubling time increase, that means we are doing better. So overall, the blue line is indicating our doubling time for Windsor-Essex, which is showing that we are doing worse than the provincial average as well as the Canadian average. From the median R0 effective perspective, we can see that our R0 is trending slightly better. Again, it's I say that with some caution, that we are close to 1 at this time, and as we have indicated earlier, our R0, if it's higher than 1, that means the cases are on the rise. If the R0 is less than 1, then the cases are decreasing in our community. So we are at 1 at this time, which is an indication that maybe the cases are stabilizing, if not decreasing, and more action is needed to make sure that we continue to keep our community safe and open. So looking at the vaccine data, so this is what our vaccine data looks like. We have seen that the vaccination rate has declined, has decreased over the time, and we continue to see that the number is getting less and less as most people are getting their second doses. They are considered completed the series, and there are still some first doses our team is giving out, which is a good sign, because that means that there are still people who are contributing to the overall protection of our community. And we'd like to see that number increase, especially with some of the newer measures that are announced recently with respect to the requirement for a proof of vaccination, whether we're talking about the healthcare setting and other non-essential business setting. And I'll take a pause at this moment to also want to acknowledge the work of our hospitals. Windsor Regional Hospital, Erie Shores Healthcare, and Hotel Dieu Grace Healthcare, hospitals to take the lead and lead by example by having these vaccination policies in place for their workers to allow a safe environment for patients to come and visit. It's absolutely critical that people who are coming in, they are sick, and there are policies in place in addition to all the other requirements that is needed to keep that place safe. So just want to take that moment to thank our hospitals, local hospitals, for taking that initiative to ensure the safety and well-being of the patients who are coming into the hospital system, and also to their own staff. So looking at our vaccination data with at least coverage rate by individuals based on different age groups and having received at least one dose. As we can see, the gradient effect, the older you are, the more likely you are to get the vaccine, and the younger people are also, that number is increasing, which is definitely a great sign as we continue to anticipate the reopening of the school next week. Our 12 to 17 number is increasing, and right now it is slightly more than the 18 to 24 groups. So thank you for all the parents and all the younger children who are opting in to take the vaccine to make themselves to get them protected, as well as to keep the school environment as safe as possible. Our second dose coverage rate is also showing the similar gradient, but there are obviously a lot of these individuals are still waiting to get their second dose. So we'll wait to see that how all of this will translate into getting them fully vaccinated before the reopening of the school and before we hit the cooler temperatures when most of these activities will be shifting indoors. From a vaccination coverage in hotspot areas, we continue to see some challenges, and also the great work that's been done, that's ongoing through many initiatives under the Healthy Community Partnerships, as well as some of the work that's been currently being done by the City of Windsor as well as County of Essex to promote the vaccination in all of these communities, and the ongoing work that our Health Unit is supporting. This is similar data, but for all residents and fully vaccinated coverage rate. So I've got a few summary slides that I would use to summarize what exactly is happening in Windsor-Essex at this time. So overall, as we can see, that the cases in Windsor-Essex has increased significantly again this week. And our wastewater surveillance data is basically aligns well with our case rate. So effectively saying that our cases are the true cases that we are seeing, and with us following up with these cases, it's absolutely important that we do everything to prevent and contain these cases as quickly as possible. We're also starting to see hospitalization and ICU admissions increasing in our community, which is obviously a concern because it will add a significant burden on our healthcare system. Our healthcare services have been delayed. Our healthcare services have been impacted throughout this pandemic. And as we continue to see the evolution of these cases and transmission going, it will have a further impact on our hospitalization and ICU admissions. So hoping that we can contain it quickly to prevent that burden on our healthcare system. So as we have talked about the vaccinated versus the unvaccinated rates, and quite often we get asked these questions, and some of the data that the province is sharing as well as we are sharing today. So this summary slide basically shows data from August 2nd to August 29th, and it's basically showing that the risk of COVID-19 infection among those who are unvaccinated is almost 6 times higher than it is for those who are fully vaccinated. So in the last month of August, between August 2nd to August 29th, those who were unvaccinated, the case rate were 617.7 cases per 100,000 population. And among those who are fully vaccinated, that number is lower, which is 108.8 cases per 100,000 population. So it tells you the likelihood of how when a person who is vaccinated will contract COVID versus those who are unvaccinated who will contract COVID. And on top of that, which is obviously because of the sample size, we don't have that data to show, but among those who are fully vaccinated, the likelihood of them getting hospitalized or developing more severe complications is even less than compared to those who are vaccinated, who are unvaccinated. And the provincial data clearly shows that the ICUs and the hospitalization is mainly by the unvaccinated people who are still waiting to get their vaccine or contemplating. So breaking that last slide into different age groups, as we can see, it's spread mainly in the younger population, 18 to 40 years age group, but it also, we can see some of that data in other age group. But please note that this is a distribution which is also shows that the coverage rate in each of these groups. The blue line obviously is showing case rates in those who are unvaccinated, and then the green line is showing basically in cases that are fully vaccinated. So when we broke down that where are these cases are coming from, so some of the key locations we have identified based on these cases is which definitely requires some action, is the type of event and location. And as you recall, we have issued a number of exposure notification as well as outbreaks in some of these locations. So wedding and ceremony, rehearsal, or reception, there are at least 7 establishments, events that we have identified so far that has contributed to almost 141 cases in our community. And the other key location that we have identified is the restaurants, and you can see that the number of these establishments is obviously high, and the number of cases that are linked with it's 67. So not the same in terms of the number of, having less number of locations with high number of cases. Obviously, you can relate it as a super spreader event. So that's not necessarily the case in restaurants, but still we are seeing that a lot of these exposures are happening in these settings, and partly, as you can imagine, that when people don't have the mask when they're sitting and eating, and if they're not following some of these public health measures while they are walking in the restaurants or entering the restaurants without mask, and that is leading to some of these cases in these establishments. The third up is the nightclub, and as we can see that there were at least 3 establishments that were linked to it, but the number of cases are pretty significant, which stands at 40 cases. Similarly, bars, 8 establishments, and then number of cases that are 28, and adult entertainment clubs, with two establishments with 11 cases. So breaking it down further in terms of how these key locations are showing that where these cases are acquired, and whether if it led to further transmission as a result of those acquisition in these settings. So what we have seen so far through this event in location, wedding, ceremony, rehearsal, or reception, there were at least 118 cases that were acquired as a result of participating in those events or establishments, and it led to 23 transmission further outside of these settings. When it comes to the restaurants, you can see that 11 acquisition happened in the restaurant, which led to 56 transmission out in the community. Nightclubs, 29 acquisition, but number of transmission is low in the further transmission in the community is slightly lower, 11. Bars, 11, and then further transmission into the community, 17, and adult entertainment club, 5. And the number of transmission that happened is a total of 6. So based on all of that data, today I'm issuing a letter of instruction pursuant to Ontario Regulation 364/20, rules for areas in step 3. So please ignore my typo. Rules for areas that are in step 3. So starting September 7th, we will be working very closely with our law enforcement partners, our bylaws, and our tobacco enforcement officers, health inspectors, for zero tolerance on non-compliance on all requirements. We have seen that while we have done extremely well in getting ourselves vaccinated and keeping our case rates down, but we have also noticed, based on all these inspection, that people are non-compliant. The businesses are not necessarily enforcing some of these requirements. The community that are going in there, also some of them are not following some of these requirements. So it's just bringing it back, some of that focus and attention, that we need to continue to take public health measures, precautions, wearing the mask when you need to, keeping a distance when you have to, and also maintaining the capacity limit in each of these establishments. On the same note, restaurants, bars, nightclubs, and adult entertainment venues to limit hours of operation to 12 a.m., that's midnight. And we intentionally did that to make sure that we are not compromising on the safety of the people, as well as we are also not penalizing too much on these establishments, because and allowing them to continue to operate in a safe manner, and trying to make sure that they are playing their part in keeping our community safe, as many of these cases are linked with these establishments at this time. For food or drink establishment with dance facilities, we are basically prohibiting dancing indoors except where the dancing is part of the employment, and 2 meters distance cannot be maintained. And again, those are all based on the data that we continue to see in our community, and based on what we have seen so far. So continuing on to that, now they're starting September 20th, because some of these will take some time and some prior instructions for wedding and funerals. And basically we are prohibiting dancing indoors except for the marital couple. So they can do the dance, the couple's dance, but not necessarily the patrons or the attendees of these weddings. Again, all of this based on the data that we are acquiring from all these exposures and the cases. Limiting the capacity of wedding, funeral, rites, or ceremonies to the number of persons that can maintain 2 meters physical distance, up to a maximum of 100 people. So that's something that we would like to see. Right now, we are getting the attendees list, which exceeds sometimes more than 200 attendees, which is makes these events even more risky for transmission. We are also requiring that starting September 20th, ensuring a proof of vaccination certificate for all attendees of these weddings and funerals to be for the purpose of attending. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
I guess just to start, the midnight requirement, what do you think happens before, or what do you think happens after midnight that's not happening before midnight? Can you explain that one a little bit more?
Well, I think the enforcement piece, that's something that's important, and also the ability for people visiting those establishments, and their ability to make an informed decision in terms of what activities that they're engaged in and what kind of physical distancing that they're maintaining. So a lot of these activities, what we came to know, it happens later on, and it's also allowing them to do some business as well. And again, the purpose of this is to find that right balance of allowing people who are visiting these establishments to continue to operate in a way which makes it safer, and also keeping the public health at the forefront. So we're hoping that this is the right balance to allow the economic activities to continue on, and also to make sure that the public health measures are kept in place to keep our community safe.
Okay, and you touched on this a little bit about seeing a slight increase in the vaccines since like the mandates and things have come up. Do you know on average how many doses you're giving out daily? I know at one point it was pretty high. Then it got to, to around 400, I want to say. So do you know that number now?
So we are still at close to 400 doses daily a day. We have seen some uptick in the last few days since the vaccination announcement, proof of vaccination requirement was announced by the province. So we have seen that update, but those are just a few days worth of data. We'll probably be able to comment more on next week's data when we have at least 1 week worth of data to see what kind of change that is impacted. But I can tell you that the number has gone up to 600 to 700 doses a day already, and we are hoping that it will continue to increase.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. 23% of cases in the last 2 weeks were people ages 0 to 19. How high do you think the risk will be of transmission in schools next week?
That's a great question, Taylor, and I think that's why it is absolutely important that we must follow some of these public health measures right now to control the cases in the community. Most of these cases that we are seeing in the younger adults are those either who are unvaccinated and or acquired through a transmission within their own family. Delta is really bad in terms of transmission. It spreads very quickly, and if one person is bringing it inside their home, the entire family eventually gets sick. So yes, the risk is high, and having these measures in place will try to reduce the risk of spread in the schools. We are already seeing some of the impact in the daycare settings, the similar reasons, and we may anticipate some of these cases in the school as well. So absolutely critical that parents, families, children, if they are sick, they are not to come to the school, and also if they're identified as a close contact, they need to get tested and stay home until they are cleared by public health or receive a negative test results. And even for parents, every child who is unvaccinated is vulnerable. So even if you're engaging in any kind of social gathering, social activities, you may also not only put yourself at risk, but also your children at risk, because they don't even have any kind of immunity at this time because they're not eligible. So hoping that some of these messages and some of these measures will reduce the risk, but with the high case rates in the community, there is a risk into the school system, and we are doing everything to mitigate some of those risks. That's why we issued the letter of memo to our school boards, requiring them to limit some of these extracurricular activities, as well as having some other stronger measures to try and reduce the cases in our school system.
And separately, the data set for the 18 to 24 age group, do you know if the population estimation for the health unit is using contains the high number of international students that typically come to the region every year?
Great question, Taylor. We can definitely try to confirm that, but my feeling is the denominator obviously will not include the international students that are coming into the region, because some of this data is the census data that our team pulled from the ministry, and I'm not sure that if the data incorporates these international students, but we can definitely confirm that.
But keeping that in mind, do you think that the vaccination rate among that age group would be higher than we're seeing the data reflect, or lower?
So it really depends on the whether these international students are registered into our COVAX system or not. If they are registered into our COVAX system and receive their vaccine here, and if they're not included in the denominator, so obviously the number is an overrepresentation of what the actual situation looks like. But on the flip side, if they are not even registered into our COVAX system and they're not included in the denominator, that means basically the data is the data, so we don't have to have any concerns. But we can definitely double check with that for that data. And the new students who will be coming in, obviously we are in contact with our universities and colleges to get them immunized based on their the guidelines, whether they're eligible to receive their vaccine at this time or not.
Thank you.
Any questions from AM 800?
Dr. Ahmed, in regards to the zero tolerance, so what will happen if these businesses don't comply? Will they be charged? Will you have to shut them down? What will happen if they don't comply?
Well, obviously, we don't want to shut any of these businesses down. Let me just be very clear. It's we want them to take that responsibility as community partners to try and enforce some of these restrictions. I get it. The last year has been a very difficult year for everyone, and especially for the businesses. And people want to do business. Totally understand that. But I think there are still requirements that currently exist in the regulations that they have to follow. So all we are asking them is to follow some of those requirements to make sure that they continue to stay in operation. It won't do any good if there is further spread in the community and we or the province shut us down completely. So it won't be helpful for anyone. What we are trying to do is we are trying to find that right balance where we can continue to stay open, we can continue to do business, and also not jeopardizing and compromising the health and safety of our residents. We have done extremely well in the third wave. We want to make sure that we bring that thought and concerns again to make sure that we don't get to the point where some of these other countries are heading. And the data that I showed, yes, vaccines are widely available in the United States, and but look at their coverage rate and look at their hospitalization and look at their ICU utilization. Their ICU utilization is through the roofs again, and one of the highest in the world. So we have to be very careful that what is at stake, and the economy is at stake, the health and well-being of our community is at stake. So I truly hope that our businesses supports these measures and continue to comply, and we don't have to end up in shutting any of these businesses down. But with the zero tolerance, we want to make sure that the message is very clear, and establishments will be charged if they are not following these regulations that currently exist right now.
When it comes to Summary 6 in regards to starting on September 20th for weddings and funerals, I know, for example, the dancing part, is there a reason why you're waiting until the 20th instead of the 7th? Is it because individuals have these events planned already?
Absolutely, Rob, you got it right. We recognize that many individuals must be planning their event much more in advance. We recognize that this, some may still argue that this is still a short notice. But again, we can't wait until a few months before we implement these measures. And we really hope that people understand that right now we have 141 cases that are linked with the wedding ceremonies, and we need to take that in control. In these type of weddings, we recognize that people want to have a good time, make it memorable, but please don't make it memorable by having a super spreader event or having COVID spread through your wedding. So please take all these measures, even now if you can, but from an enforcement perspective, we will start to enforce and expect everyone to follow these measures starting September 20th.
And finally, I know it's probably tough to say because I know you issued some other orders and the timelines, but for this timeline, it all depends how our numbers are going to shape up, I guess, the next few weeks, months.
Absolutely. So we're seeing that, and I think I think it was Taylor who raised that question about the school. One of my biggest concerns right now is the school. We want to make sure that we keep our schools open, we keep our children getting the education in the school system. So we'd like to see what kind of impact it will have in our school system. Also, we know that the vaccine verification system will kick in September, on September 22nd in the province, and then what kind of an impact it would have in the overall transmission in the community. So if everything stays good, people get the vaccine, people continue to, businesses continue to operate in a safe manner, we will remove these restrictions. But right now, I think there's too much of a risk at this time. Unless we take these measures, we don't think that this risk can be mitigated. And just on that note, there are many activities that are currently still allowed. And one of the things that I just want to mention as well, that we didn't find so far. I should just say so far we didn't find any super spreader event or any identified like a major source of transmission through social gatherings, private social gatherings, whether indoors or outdoors. We haven't found that yet. So that's why we didn't even touch on imposing any restrictions or regulations there, recognizing that, when these type of small social gatherings, people who are attending, everybody knows everybody. And most of these people who are coming in, they expect people who are participating on those events, they're vaccinated. And maybe that's the reason that it's not spreading. But when we are talking about these non-essential businesses, there are people who you don't even know who's vaccinated, who's not vaccinated, and what kind of risk that they're bringing in. So it's just the having these measures in place will help us to get a better sense of where this spread is happening, so that we can target. We don't want to make any kind of sweeping measures to just take a blanket measures and shut down everything, and have a major impact in our community. We're targeting some of these activities or these measures based on the data and based on the potential impact that we can anticipate. Once all of that is figured out and we get to a better position, we will be removing these requirements so we can all continue to enjoy all the activities that we normally enjoy.
Thank you.
Any questions from CTV?
Just to clarify, when it comes to weddings, is it the responsibility of the venue to make sure that people were wearing masks while they were attending those indoor weddings? Like, were they required to make sure that was in place, or was it basically just the attendees that were supposed to take precautions?
Well, I think it's the joint responsibility, but because the establishment has to follow the regulations, the establishment has a bigger responsibility in ensuring that the visitors, the party that's happening, it complies with the regulation, because it's their venue and the regulation is applicable to them. With some of the letter of instruction that I've issued, there are some requirements that would be on both. If the wedding is happening at a venue, then it will be the responsibility of the venue. But if it's happening somewhere outside or private, the host will be responsible to make sure that these measures are being followed.
So has any of those venues been charged at all, or how have they been disciplined, or?
At this point, no charges, but we are working to make sure that the clarity is there. The regulations lay out all those details, what the expectation is, and starting September 7th, these measures will be in place, and violations will be charged based on the zero compliance directive that I've asked our team and our bylaw enforcements to implement in our community.
So will you guys have bylaw enforcers like during the weddings, checking things out? How exactly are you going to be making sure that everything's being followed properly?
Well, just like we do with everything else, our people are not everywhere, but we do spot checks. We want to make sure that we are using our staff efficiently, and not to be punitive in any way, but mainly to be supportive in ensuring that the compliance is there. But if they notice any violation, people will be charged, and we are working closely with our team to have a good plan on how frequently that we have to make sure that we are dropping in to see how the compliance looks like. It can be random, it can be more planned, all depends on the team. So I can't share all of those details, but I can't guarantee that they will be everywhere, but they will be doing their part to make sure that all these requirements are fulfilled and people are complying to these requirements.
And do you have like a dollar figure in mind about how much they could be charged?
Well, it would be depending on the violation and depending on what the regulations allow. I can't speak to that at this time, but it's all laid out under the regulations.
Okay, and just regarding the September 20th, weddings and funerals being limited to a max of 100 people. So what message do you have for the bride and grooms out there who have, say, invited already 150 people, 250 people to their weddings? And now, are you, just to clarify, are you expecting them to cut back to 100 then?
Well,
if invitations are already out and everything like that.
Yeah, unfortunately, that's something that would be tough. We completely recognize that. That's why we are extending it even until to September 20th. But the reality is, this is still a pandemic. And we are seeing our case rates are highest in the province at this time in Windsor-Essex. And while I completely understand that these events and these plans happen much more in advance, but having a gathering of 200 or 250 people, that's a lot. So you are basically inviting trouble if you have that many people coming to, especially an indoor event or to a place where there will be much more interaction. And that's why there are some reasons that we always say about the capacity limit, that what is the capacity limit, how much people should be putting a cap to. So 100 is something that's still, it's a compromise. It could even be less, and we contemplated on the number as well. We felt that 100 is still enough to allow the activities to carry on and mitigate some of that risk. If we are looking for full mitigation, easier solution would be to maybe just cancel it or bring it down to maybe 25 people or less. But right now we are capping it to 100. And again, all based on data that we have seen in terms of the spread and in terms of the transmission.
Okay, and what advice do you have for people who attended these weddings to know that they have indeed come in contact with someone who tested positive? But I know some people don't have symptoms. So I know some people have been turned away from the hospital assessment center because it hasn't been 7 days since the date of exposure, and yet they aren't allowed to get a rapid test, say at Shoppers, because they have come in contact with someone that they're aware of, and they're just directed to go to the hospital, but the hospital's not taking them either. So what do you have to say to those individuals who may be a little frustrated? They don't know what to do. They don't know how to ensure that they're keeping the other people around them safe.
So there are, I guess, recommendations for these people, and the likelihood of and the instruction that comes with them if they are fully vaccinated versus if they are not vaccinated. So those risks and exposures need to be identified, and if we deem that it's an outbreak, then as a part of an outbreak, then anyone who is part of that outbreak or linked with that outbreak, they have the ability to go and get tested. If it's some like a 1 or 2 odd cases, and we don't necessarily know that if it's widespread, then they may not be at risk, and their recommendation would be to monitor their symptoms, especially if they're fully vaccinated. If they're unvaccinated and if they're experiencing any symptoms, they need to isolate immediately and go for testing. Yeah, I'll have to check with my team to make sure that these instructions are clearly given out to all the people that are impacted by it.
Okay. Also, have we, regarding, since the vaccine policy came out, have we seen an increase at this time of people getting, can you describe that again, an increase of people who have been getting their first and second doses since Wednesday, I believe it was?
Yeah, that is correct, Stephanie. We are starting to see the uptake in the new first doses since the announcement has been made. As I said earlier, it's early data, but on an average, we were vaccinating close to 400 people. And right now we are up to 600-700 people a day at our vaccination clinic. And we are expecting that number will continue to increase as people are getting the information, getting the news that about these requirements, and hoping that we get to the 90% mark that we need for the most part to prevent any Delta spread.
Okay, and just one last question regarding
lost you.
Indeed check to make sure that the people entering their establishment have a vaccination record with them. What will those penalties be?
I lost you for a moment, Stephanie, so can you repeat your question?
Oh, sorry about that. Just regarding local businesses and the vaccine passports, what type of penalties will business owners face if they fail to check for vaccination records for people entering their establishments?
So we haven't seen the actual regulation from the province that's mandating these requirements. So I can't comment what kind of charges that we are seeing. My expectation is it would be similar to what is currently exist in any other type of violations under the regulation.
Okay, thank you.
Any questions from CFTV?
Hi, yes, good morning, Dr. Ahmed. With schools being open and case numbers rising as they are, I was informed actually as a parent the other day that I had to return my daughter's band equipment because they were starting up band again at the school. How safe is this when you are talking woodwind instruments and children blowing into these things and different cohort groups congregating to play their instruments? Is this something that is safe?
Well, we provided some guidance on that in our school toolkit, and it does touch on musical instruments. Obviously, depending on the type of activity, depending on the arrangement, there may be some risk, but the guidance that currently exists under the Ministry of Education and in our toolkit, it is trying to minimize that risk. I can't say that anything is risk-free at this time, but following these measures will definitely help to reduce the risk for students in the school.
Okay, another question for you. With the new vaccination restrictions, everyone entering restaurants as of a certain date will be required to provide their proof of vaccination. People are asking me how come it is that I have to provide, if I'm going into a restaurant, my vaccination certificate, and my bartender and my server doesn't even have to be vaccinated in order to serve me. And I said I didn't know, and I would ask you this morning.
Well, I think that's a gap in the regulation for sure from the province, but again, the risk is different, right? So when we're talking about people who are accessing the establishment, so they will be taking off their mask, they will be eating, compared to an employee that is already under the requirement that they have to wear the mask and face shield when they are serving their patrons. So the requirements are slightly different. It would have been easier if the businesses are also included for their employees to have that type of proof of vaccination. But again, right now, that's something that the expectation is the businesses will do to require the proof of vaccination from their employees, just like the hospitals have done that already, and then to ensure the safety and well-being of their patients. So the patients that are coming in, they are much more vulnerable. they are sick and they need that support. So from the risk side, if any of them contract COVID because of an employee, it's a much bigger risk compared to the other way around. When people are visiting those bars and restaurants and establishment, the patrons themselves do not have any personal protection for them, but the staff and the employees are wearing those masks and face shields before they serve them.
Mm-hmm. And one more question for you, just regarding grocery stores. We've had in Leamington, there have been a few patrons that have come into the grocery store, and the grocery store staff, and it's 5 or 6 families of Mennonite families actually coming in, and they're not wearing masks, and they're just wandering through with an entire family. And when approached by, when you approach the people that work there, they say, well, we can't enforce the mask bylaw at all in here. Our company says that we are allowed to let these people in. They can just wander mask free. These people are not being respectful. And it was brought to my attention numerous times, so I went in to check it out myself, and sure enough, this was on a Friday night, and it was bad in there. And I thought maybe bringing that to your attention, letting you know that, this is something that can be a real concern to the community when you've got a big box store and you've got, 5 or 6 families walking around the store not wearing masks, and no employee is able to say anything to them. So I thought I might mention that today.
For sure, I'll flag this to my enforcement team as well, but I think there are certain exemptions, and we'll have to make sure that people who are exempt based on those regulations, they are exempted, versus the others who may not necessarily be exempted. So I'll flag this for follow-up and see if if we need to do anything more.
Wonderful. Thank you very much. No further questions.
Okay, thank you everyone for joining us today. Given the time, we're just going to end it here. Just want to let everyone know that the letter of instructions will be posted on wechew.org later today, and that our offices will be closed on Labor Day.
Thanks, Mike, for reminding me. Yeah, our offices will be closed.
But the vaccination clinics that were scheduled to be open will be operational. Thank you, everyone. Have a great weekend.
Will Dr.